The production of so-called virus diseases and virus inclusions by poisons. The public, as well as many physicians, is under the impression that viruses are living organisms comparable to a germ that enters the human, animal or plant to cause the disease. The scientists, who are authorities on virus diseases, are in disagreement as to the nature of a virus. It is not generally realized that some so-called virus diseases may result from the effects of poisons on the human body. Thus, herpes zoster may follow exposure to carbon monoxide or the administration of arsenic, bismuth, lepidol, gold, mercury, tuberculin, alcohol, etc. An epidemic of herpes zoster and peripheral neuritis, similar to the Jake paralysis epidemic in this country, followed the ingestion of arsenic in beer in Manchester, England in 1900. The toxic agent was determined to be arsenic arising from dextrose made from starch by the use of crude sulfuric acid containing this poisonous substance. Herpes simplex, another so-called virus disease, has followed the ingestion of alcohol, benzyl, arsenobenzyl, mercury, and the inhalation of either, among other poisons. Van Rijn noted its appearance after sulfapyridine therapy. Herpes simplex has followed the injection of vaccines, milk and colloidal metals. Inclusion bodies have been defined as products of virus activity or the elementary virus bodies themselves. Inclusion bodies have been found in poisoned humans and experimental animals. Cox and Olitsky, 1934, found that the injection into animals of aluminum hydroxide produced inclusion bodies similar to those seen in infectious encephalitis. Van Rijn and Rhodes, in their textbook, 1948, Virus Diseases in Man, state, histological changes similar to those seen in infectious encephalitis may be produced by carbon monoxide poisoning, brain injury, arteriosclerosis, uremia, pregnancy toxemia and toxic agents like alcohol and lead. Olitsky and Harford, 1937, were able to produce inclusion bodies indistinguishable from those observed in virus infections by the injections of aluminum compounds, ferric hydroxide and carbon. Mistakes that have been made in the past. Several commissions, appointed during the first quarter of this century to investigate the cause of pellagra, concluded from their studies that pellagra was an infectious, contagious disease. Harris, 1913, was able to inject Berkefeld filtered tissue material from pellagra victims into monkeys to cause a corresponding disease in these animals. He concluded from these experiments that a virus was present in the injected material and that it was the cause of pellagra. If the work of Harris had been followed exclusively, various strains of this virus might have been discovered, and a vaccine, effective in experimental animals, might have been developed, as in the case of poliomyelitis. Today, as a result of unlimited research, however, we know conclusively that pellagra is not caused by a virus, but rather that it is a vitamin deficiency disease. It is obvious that if the investigations of pellagra had been restricted to the virus theory, it would still be a mystery. The symptoms of milk sickness in man resemble those of influenza or grippe, gastritis, and so-called ptomaine poisoning. As a matter of fact, so-called summer grippe or flu often occurs during epidemics of poliomyelitis. There were 10,000 cases in Cincinnati in 1947, which were thought to be related to poliomyelitis and were considered, therefore, virus infections. However, Matson, 1950, writing about poisonous plants, says that some physicians have expressed the opinion that mysterious outbreaks of so-called summer flu in the late summer are often due to milk contaminated with tremetil. The observation that human and bovine outbreaks of tremetil poisoning occur simultaneously corresponds with similar observations made during epidemics of poliomyelitis. Medical reports have shown repeatedly that paralytic diseases in horses, pigs, dogs, cats, ducks, chickens, etc. occur simultaneously in districts where epidemics of poliomyelitis are prevalent. The disease that we now know as poliomyelitis was not designated as such until about the middle of the 19th century. Prior to that, it was designated by many different names at various times and in different localities. The simple designations, paralysis, palsy and apoplexy, were some of the earliest names applied to what is now called poliomyelitis. Paralysis, resulting from poisoning, has probably been known since the time of Hippocrates, 460–437 BC, Boerhaave, Germany, 1765, stated, "We frequently find persons rendered paralytic by exposing themselves imprudently to quicksilver, dispersed into vapors by the fire, as guilders, chemists, miners and perhaps there are other poisons, which may produce the same disease, even externally applied." In 1824, Cook, England, stated, Among the exciting causes of the partial palsies, we may reckon the poison of certain mineral substances, particularly of quicksilver, arsenic, and lead. The fumes of these metals or the receptance of them in solution into the stomach have often causes paralysis. Colton, 1850, mentions the case of a patient who swallowed some arsenic accidentally and was admitted to the hospital. The primary effects of the poison had been successfully combated with proper remedies, but 7 days afterward he became paralyzed. It is significant to note that there was a latent period of several days before the paralysis appeared, since this delayed reaction is comparable to the incubation period in infectious diseases. In 1881, Popo of St. Petersburg published an essay upon the pathological anatomy of arsenical paralysis as produced artificially in animals. The work of Popo was carried out under the guidance of the distinguished neurologist and microscopist, Professor Mirzaevsky. Popo concluded that arsenic, even in a few hours after its ingestion, may cause acute central myelitis or acute poliomyelitis. During an epidemic of poliomyelitis in Australia in 1897, Altman pointed out that phosphorus had been widely used by farmers for fertilizing that year. This observation may be of significance since in recent years organic phosphorus insecticides, such as parathion, have been suspected as possible causes of poliomyelitis. Onif, 1900, reported a case of a painter with flaccid paralysis of both legs, in whom the autopsy showed lesions characteristic of poliomyelitis. Obstractions, 1902, reported a case of acute poliomyelitis resulting from arsenic poisoning. Philip and Gothard, 1903, reported a case of anterior poliomyelitis from lead poisoning. Collins and Martland, 1908, reported a case of poliomyelitis in a man, 38 years of age, which resulted from the use of cyanide as a silver polish. The illness began with diarrhea, followed by headache and pain and stiffness in the back of the neck. About 8 days after the onset of the illness, he became paralyzed. In discussing Collins and Martland's paper, Larkin stated that he had seen one instance of this disease following potassium cyanide poisoning. In the spring of 1930, there occurred in Ohio, Kentucky, Alabama, Mississippi and other states, an epidemic of paralysis. The patients gave a history of drinking commercial extract of ginger. It is estimated that at the height of the epidemic, there were 500 cases in Cincinnati district alone. The cause of the paralysis was subsequently shown to be triethocrasyl phosphate in a spurious Jamaica ginger. Death resulted not infrequently from respiratory paralysis, similar to the bulbar paralysis deaths in poliomyelitis. On pathological examination, the anterior horn cells of the spinal cord in these cases showed lesions similar to those of poliomyelitis. These incidents show that epidemics of poisoning occur and furthermore, that epidemic diseases do not always indicate that they are caused by infectious agents. Moreover, following the ingestion of the spurious Jamaica ginger, the symptoms appeared 2 to 10 days later. In some cases a longer time elapsed. This latent period is comparable to the incubation period of infectious diseases. As a matter of fact, the incubation period of poliomyelitis is commonly stated to be 7 to 10 days on the average. The so-called incubation period in poliomyelitis and the latent period in these cases of poisoning, therefore, are strikingly similar in length. Lienhard et al., 1951, described acrodynia in the course of 3 cases of acute poliomyelitis. Some authorities have considered acrodynia to be caused by a poison. Elmore, 1948, reported 2 cases of this disease following the ingestion of mercury, and Warkany and Hubbard, 1951, found mercury in the urines of 92.7% of 40 acrodynia patients. Meyerhofer, 1939, reported that infantile acrodynia may immediately follow certain forms of atypical poliomyelitis, especially encephalomyelitis. Mercury is used as an insecticide and a fungicide, and the above clinical observations indicate that it might be a factor in producing some cases of poliomyelitis. In 1936, during a campaign to eliminate yaws in Western Samoa by the injection of arsenicals, an epidemic of poliomyelitis appeared simultaneously. In one community all of the patients developed paralysis in the same lower limbs and buttocks in which they had received the injections, and this pattern was repeated in 37 other villages, whereas there was no paralysis in uninoculated districts. The natives accused the injections as the cause of the epidemic of poliomyelitis. Most of the cases of paralysis occurred 1 to 2 weeks after the injection of the arsenic. The foregoing reports indicate that poisons can cause poliomyelitis. It would appear that not any one poison in particular would be responsible for all cases of poliomyelitis, but the effect of any one of several could produce the same ultimate result. When a disease is known to be caused by a poison, it is obvious that a search for a germ or virus in relation to it would not be made. Conversely, if a so-called virus is believed to be associated with the disease, then the possibility of poisoning as the cause of the disease would not be considered. It will be shown, moreover, that some so-called virus diseases and virus inclusions can be caused by poisons. The fact that ascorbic acid has been effective in the treatment of poliomyelitis appears justly to imply that this disease has a poison cause. Ascorbic acid has been used as a reducing agent in the treatment of poisoning resulting from a number of toxic agents, including coal tar antipyretics, nitro compounds, aniline, cyanide, benzene, lead, arsenic, etc. Paralleling these modern scientific investigations is the observation over a century ago that lime juice and lemon juice were protective against the poisoning by fish, which sometimes resulted in paralysis. This early observation is perhaps the principal reason why lemon juice is customarily served today when fish are eaten. The fact that methylene blue, another reducing agent, is effective in the treatment of poliomyelitis also points to the poison cause of this disease. Methylene blue has been used as an antidote in the treatment of nitrite, cyanide, carbon monoxide and other poisonings. Relationship of harvest to poliomyelitis. In 1907, Dr. H.C. Emerson, Massachusetts State Inspector of Health, District 14, investigating an epidemic of poliomyelitis in that state, made a careful inquiry regarding the diet. No infant who was fed exclusively on the breast developed poliomyelitis. He found in 6 cases that fruit and berries had been a large item of the diet. In the cases of 2 infants, bananas and berries had been given in the diet in addition to breast milk. In 3 cases of poliomyelitis, the illness was attributed to the eating of large amounts of blackberries and blueberries. In 1 case the illness was credited to eating heartily of English mulberries. In 39 instances it was stated that food supplied were bought from fruit and vegetable peddlers in their localities. Dumey in August 1932 pointed out that some authors thought that poliomyelitis is a disease of gastrointestinal origin, which might follow the ingestion of foodstuffs. In 1933, they noted that the epidemic peak of poliomyelitis corresponds with the harvest peak of perishable fruits and vegetables. They called attention to the fact that the disease occurs only in those countries which raise the same type of agricultural products. Dr. C.W. Burhans, one of the colleagues of the authors, thought that green apples might be a factor in the etiology of poliomyelitis. Toomey et al. 1943 points out that there is frequently a history of dietary indiscretions previous to an attack of poliomyelitis. They suspected that a virus could be found on or in unwashed fruit or in well water during epidemics of poliomyelitis. Every year for 8 years, therefore, grapes, apples, peaches, and pears were collected from the vineyards and trees in northern Ohio at the time of the ripening. In none of their studies was the so-called virus of poliomyelitis demonstrated when the washings of the fruit or the well water were injected into experimental animals. However, no chemical tests were made to determine whether or not a chemical substance on or within the fruit or in the well water, acting by oral ingestion to produce poliomyelitis, was present. Barber, 1939, reported 4 cases of poliomyelitis that developed simultaneously on the same day from the eating of strawberries in a single house of a boarding school. He says that the simultaneous onset of these cases resembled food poisoning. The seasonal and climatic incidence of poliomyelitis, he points out, agree closely with the seasonal increase in the consumption of fresh garden production. He says that the epidemiological distribution of poliomyelitis resembles food poisoning. Behrens, 1949, points out that a study of the epidemiology of poliomyelitis shows a definite correlation with the harvesting of fruit and vegetable crops and to changes in climate, weather and humidity. The harvesting of such fruits as cherries, grapes, berries, apricots, etc. and the edible vegetables, as lettuce, radish, cucumbers, etc. usually from June to September, corresponds with the period of poliomyelitis epidemics, Behrens points out. Toomey et al. 1949 made important experimental observations that show a correlation of the poison and virus theories of poliomyelitis. They considered it possible that a fruit, which enters the gastrointestinal tract, could act as a precursor of catalytic enzyme on a normal constituent of the tract and accelerate the production of poliomyelitis. Unsupernates of peach skin mash were injected intracerebrally into cotton rats, followed at intervals with intracerebral injections of the so-called poliomyelitis virus. Accelerated production of paralysis occurred. Because of the presence of cyanophore glycosides in peach skins, a synthetic preparation, succinonitril, was injected intracerebrally into the experimental animals. This chemical accelerated the production of the disease similar to that produced with the peach supernates. Toomey et al. Emphasized that the injections of fruit supernates were made in a manner that does not occur under natural circumstances. Sabin, 1951, although insisting on the virus etiology of poliomyelitis, implicates food and drink as important factors in the cause of this disease. He points out that measures which are often advocated to combat poliomyelitis epidemics are not warranted, such as a. Avoidance of crowds, large gatherings or sports events, b. Exclusion of children under 16 years of age from movies, churches, or schools, and c. Exclusion of poliomyelitis patients and suspects from general hospital wards. Factors precluding investigation of the poison cause of poliomyelitis. It is obvious that in the study of poliomyelitis every possible cause, including the possibility of poisoning, should be investigated. Since 1908, for 44 years, poliomyelitis research has been predominantly directed along only one line of investigation, i.e., the infectious theory. This single line of study, precluding other possibilities, including the poison cause of the disease, has resulted from two factors: 1. The public health law, and 2. The insistence, based entirely on animal experiments, that poliomyelitis is caused by a virus. 1. The public health law. The inclusion of poliomyelitis in the public health law as a communicable, infectious disease dates back to the early part of the 20th century. At that time many diseases, now known to be neither communicable nor infectious, were considered to be caused by an infectious agent, simply because they occurred in epidemics. The general attitude of that period is expressed by Sachs, 1911, in his statement. In general, the epidemic occurrence of any disease is sufficient to prove its infectious or contagious character. The vitamin deficiency diseases, beriberi and pellagra, are outstanding examples of epidemic diseases that were formerly considered to be infectious and communicable, according to the logic employed by Sachs. In fact, we find pellagra incorporated into the public health law as a communicable disease in the state of Pennsylvania, in the following rule and regulation adopted January 5, 1910. That all physicians practicing within the limits of the state shall make immediate report of each and every case of Incineratus duodenalis, hookworm disease, and pellagra and anterior poliomyelitis, infantile paralysis, occurring in their practice in the same manner that other communicable diseases are now by law, and by rule and regulation of the State Department of Health, reported to the health authorities. A state health officer recently wrote to me as follows. I think all of us will agree with you that in the past, as is still probably true, public health rules and regulations and sometimes even public health laws were influenced too much by what we did not know, rather than by what we did know. This was probably an acceptable line of reasoning in the past, but with increasing public health education and greater understanding and cooperation from citizens, this justification becomes less acceptable. The fact that an extensive epidemic of poliomyelitis was prevailing in the states of New York and Massachusetts in 1907 aroused a suspicion that the disease was infectious and communicable. It was therefore incorporated into the public health law as such. However, conclusive evidence of contagiousness was not established during that epidemic, nor in subsequent ones. Moreover, during the greatest epidemic of poliomyelitis in recorded history, as shown by the records of the U.S. Public Health Service and the New York State Department of Health, Time magazine, commenting on these surveys, points out how, when and where people catch polio remained a mystery. In addition to the failure to prove contagiousness of human poliomyelitis, it has likewise been impossible to prove contagiousness of poliomyelitis in experimental animals. This fact will be considered in detail later. As a result of the inclusion of poliomyelitis in the public health law as a contagious, communicable or infectious disease, investigations regarding it are almost exclusively in the hands of specialists in virology and public health. The country doctor, general practitioner, and clinician have little or no opportunity to participate in poliomyelitis research under these circumstances. Medical advances of the utmost importance have been made in the past by general practitioners. An outstanding example is the work of Dr. Edward Jenner, a general practitioner in Gloucestershire, England, whose observations and deductions brought about vaccination against smallpox. All advances in medicine do not result from laboratory experiments. Any doctor in any community, however small, and however limited his opportunities, may make a fundamental discovery, but he must be given the opportunity to participate in the program, and his observations and deductions must be given adequate consideration. 2. Virus research. The more or less general acceptance of the idea that poliomyelitis is caused by a virus arose from experimental animal studies by Landsteiner, 1908 in Austria, and Flexner and Lewis, 1909, in the United States. These experiments showed that a substance obtained from poliomyelitis victims could produce a paralytic disease when administered to experimental animals. It has been assumed, as a result of these experiments, that an exogenous virus is the cause of human poliomyelitis. Dr. Harold L. Amos stated in 1928. By reason of the parallelism of the human and experimental disease, it is believed that inferences drawn from experiments with monkeys may be accepted with a certain degree of safety as applicable to the solution of problems in connection with human cases. The portal of entry of the so-called virus of poliomyelitis into the human body never has been established. The question of the portal of entry is summed up in the published reports of the International Poliomyelitis Congress that was held in New York City in 1948. The modulator stated, "We do not know too much about the portal of entry in human beings," and Dr. John R. Paul, of Yale University, stated, "I would say we do not know the portal of entry in human beings." It was mentioned in the foregoing that human poliomyelitis has not been shown conclusively to be a contagious disease. Neither has the experimental animal disease, produced by the so-called poliomyelitis virus, been shown to be communicable. Rosenau, 1921, stated, "Monkeys have so far never been known to contract the disease spontaneously, even though they are kept in intimate association with infected monkeys." 20 years later, 1941, Dr. John A. Toomey, a poliomyelitis authority, stated, "No animal gets the disease from another no matter how intimately exposed. It is extremely difficult to understand how a human can contract poliomyelitis from another individual through dissemination of a virus by contact, carriers, excrement, unclean hands, unwashed fruits and vegetables, flies, etc. when a healthy animal in the same cage with an infected animal, exposed to all of these natural factors, remains unaffected. It appears obvious, therefore, that communicability should have been established conclusively both in humans and in experimental animals before poliomyelitis was incorporated into the public health law as a communicable disease." Some investigators have as a matter of fact pointed out that human poliomyelitis and the disease produced in experimental animals from human material, etc. are not the same disease. Toomey, 1935, for example, stated that intranasal and intracerebral inoculation of poliomyelitis virus in the monkey does not produce the same disease that is seen in man. Dr. Claus W. Jungeblatt, a well-known bacteriologist who has worked on the poliomyelitis problem for many years, recently stated, 1950. Whatever the final answer may be, it seems a reasonable statement at this time that the highly specialized neurotropically fixed virus, which has been maintained in the past by intracerebral passage in rhesus monkeys, is more likely a laboratory artifact than the agent which causes the natural disease in man. The logical conclusion appears to be, therefore, that the laboratory experiments with the so-called virus of poliomyelitis are merely of academic interest and have no practical application to human poliomyelitis. For almost half a century, poliomyelitis investigations have been directed towards a supposed exogenous virus that enters the human body to cause the disease. The manner in which the public health law is now stated imposes only this type of investigation. No intensive studies have been made, on the other hand, to determine whether or not the so-called virus of poliomyelitis is an autochthonous chemical substance that does not enter the human body at all, but simply results from an exogenous factor or factors, for example, a food poison. Analogous reactions are well known as illustrated by the production of experimental sarcomas by indole, arsenic, tar, etc., and which have been transmitted by Berkefeld filtrates. The discovery in recent years of the so-called Coxsackie virus has tended to further confuse the entire poliomyelitis problem. Hoyne, 1951, for example, states that the announcement of this discovery is accompanied by some feeling of dismay. In view of the foregoing announcement, it seems that trained investigators have added one more problem to the nebulous conditions enveloping poliomyelitis. One might also be tempted to make the statement that the more we learn about poliomyelitis, the less we know. Hoyne's statement applies obviously to the confusion that has arisen from exclusive virus studies in poliomyelitis. The Lancet editorial, 1951, also indicates the complexity of the problem brought about by the discovery of the Coxsackie virus, as follows. A crop of new snags is coming along as every week brings new tidings of the Coxsackie viruses. Many diseases have been considered to be caused by viruses, but virus studies constitute only a portion of the investigations intended to determine the cause of the disease. Poliomyelitis investigations, on the other hand, have been confined exclusively to virus studies. Because of this situation and the public health law, those who maintain other opinions, including those concerned poisons as the cause of poliomyelitis, can neither obtain funds from any source for research nor cooperation for investigating their ideas. Reappraisal and investigation of all theories, infectious and non-infectious, are imperative.